Hi everyone, Dr. Nemechek here. I want to go over Crohn's disease and how you can treat this using rifaximin and in conjunction with the Nemechek protocol. So we've had several people come to us with Crohn's, and either they're afraid to use the what we call the biologics because of some of the immune suppressive risks that go with that, or they can't afford it, or it's not covered, and we use rifaximin and as our major treatment element. Now people are kind of surprised by that so here's your gut. Well, first, Crohn's is an inflammation primarily in the small intestine. You can have some in the colon, you can have some in the esophagus, but predominantly it's an inflammatory disorder in the small intestine. Now, rifaximin, as you may be aware of my other videos, we have a condition called SIBO here, where you have normal bacteria that should be in the colon are living in the small intestine. This is what rifaximin fixes. As a matter of fact, this is the only thing rifaximin fixes. And it may go by different names like IBS with diarrhea, hepatic encephalopathy, whatnot. But when you take rifaximin, it basically removes the colon bacteria that are abnormally living in the small intestine to get you like this, okay? There are two papers where treating patients with Crohn's patients with rifaximin twice a day. Here's one here, here's another one here. I'll put both of these links to these in the kind of comment section. And here, this one, twice a day, 12-week treatment, clinical response, remission, 52%. Okay, and then just positive clinical response is 67%. But most, you get half the patients going into remission with rifaximin. Okay, if your insurance will cover it, it's cheap. If it doesn't cover it, it's not cheap, and so you get a prescription from your doctor, and you can buy it inexpensively from these Canadian mail order pharmacies. And you have a good chance, a 50% chance you can go into remission. I personally believe when we add our fish oil and olive oil, and I would use at least 5 minutes of vagal stimulation a day, we haven't had a single one not go into remission, okay? And so it's been very, very effective here. Now, say you're on a biologic, and say it's not covered anymore, or you're starting to have side effects, and the biologic is controlling things. Here's a paper that helps maintain. Oh, no, that's just another one that shows you'll put you in remission. But here's a paper showing it'll maintain your remission, so you can get off the biologic, okay, and all that risk. Rifaximin has almost no risk, okay? It doesn't get in the bloodstream. It's not gonna. If it doesn't get in the bloodstream, it can't go and, say, bother your kidney or your liver or something like that, okay? It doesn't damage your biome, and there's no clinically relevant long-term remission resistance with this. And so it's a great option, but nobody offers it to the Crohn's patients. And I'm just a little suspicious because, if gastroenterologists put all their Crohn's patients into remission, that's a lot of money out of their pocket. I hate to say it, but that's kind of how medicine works. So if you got Crohn's and you're tired of the biologics, or they aren't working, or they aren't covered, copy these papers, go see your gastroenterologist and ask them, I want you to treat me with rifaximin, and let's see if it works. All right? That's all for today, everybody. Take care. Have a good day. Bye.